It's time for the Slocum-Dickson Medical Moment, courtesy of Slocum-Dickson Medical Group. Burstone Road in New Hartford, SDMG.com. Slocum-Dickson Medical Group, SDMG.com is the website. Adrian, of course, is with us. Adrian, good morning again. How are you?
Good morning. I'm good. How are you?
Fantastic. Before we get into our guest, talk to me about the Go Red for Women event that's later on. You're going to be there.
Yeah,
with
I'll
stuff,
be
right?
there. Yep, today's the Go Red for Women luncheon, and it's an event, obviously, to raise awareness about women and heart disease. We'll be there. They have like a health expo part of it before the actual luncheon begins, and that's where we'll be. And we're going to be doing some screenings. I know definitely we'll be doing pulse oximetry, which measures the oxygen level in your blood. And then we'll also have, that's kind of a cool little simple test that you can do, non-invasive or anything. You don't have to do anything special, it's just on your finger. And then we'll have a bunch of information there about our physicians and just some general health information as well. So if you're hearing us on the radio and you're going to be at the Go Red Luncheon, stop by and talk to us. It's at Danielle's.
Okay. Mm-hmm. Wonderful. Wonderful. Yeah. And would you like to introduce who you brought with you today?
Yeah. May is Skin Cancer Awareness Month. So with us we have our plastic surgeon, Dr. Krasniak, and he can talk to us about skin cancer and keeping ourselves safe.
Dr. Krasniak, good morning. How are you?
Good morning.
Okay, so first off, when people start talking about plastic surgeons, when people find out, I'm sure that, everyone has like a question about something on their body. Can you take a look at this? What's going on with this? What's going on with that? But it's not all boob jobs and nose jobs, right? I mean, there's so much more.
That's right. I mean, we do a lot of obviously cosmetic surgery, aesthetic surgery, but we also take those skills and apply them to patients that have other problems such as skin cancer, especially skin cancer on the face. We also do breast surgery, breast reconstruction. So plastic surgeons do a lot more than just cosmetic surgery.
Absolutely. So talk to us about, we're talking about skin cancer. Warning signs. When should you have something checked out? Because really you don't want to go in for every little thing, but at the same time you don't want to ignore things. It's a fine line.
Exactly. Everyone should know his or her own body, and anything that's new, any new growth that's developing. It's normal to have moles. It's normal to have rashes develop. But if there's something new that's persisting, one of the sayings is check your birthday suit on your birthday. Once a year, check yourself out completely. You should know what things look like. And if something is new, something is developing, have your primary care physician take a look at it. Or if there's something very suspicious, a dermatologist or a plastic surgeon can get involved.
Yeah, I try not to have all the lights on when I'm in my birthday suit. So that's going to be the challenge, is to bring the lights up and not scare myself when that happens.
You'll be all right.
Talk to me about like prevention. What are some things that we can do to kind of help not go there? You know what I'm saying?
Well, most skin cancers are caused by sun exposure.
Okay.
More people get skin cancer from tanning beds than get lung cancer from smoking.
No kidding.
No kidding. So the first thing you can do is not expose yourself purposefully to ultraviolet like tanning beds. And thankfully, I think we see more people doing the spray tanning and getting away from the tanning beds, because everyone knows now that tanning beds cause cancer. So, but being out in the sun causes cancer as well. So protecting yourself from excessive sun exposure, sunblocks, sunscreens, being in the shade, wearing hats and clothing are very important.
Now, when I was a kid, I'm gonna end up dating myself here, but when I was a kid, we literally we ran around and we got red in the face and whatnot. It seems like, and maybe it's just because I'm a parent now, but it seems like you can't have the kids out in the sun as long without reapplying the sunblock or the sunscreen. It seems like the intensity of the sun has gotten more and more over the years.
Well,
or maybe that's just me.
I think we're aware of it because certainly when we were younger there was not the information that we have now about ultraviolet light causing cancer. But that being said, I think there's always concern about the changing environment and the ozone layer and things like that. But sun exposure is the thing that causes cancer, and protecting yourself is quite easy. It's just using sunblock, but it's getting in that habit. It's getting into the habit of trying to avoid the sun, not laying in the sun. This time of year in this part of the world, we can't wait for the sun to come out after a long gray winter or day like today. You want to sit by the pool, but you have to realize that the damage is being done.
Well, it's that fine line because people really like the way they look with that golden brown.
I think that's changing, don't you? I think everything sort of follows what happens in Hollywood, and we're not, 30 years ago everyone was tan, but the actresses these days, you're not seeing that bronze look. You're seeing more a natural color.
Very true.
Which is good.
So again, this is Slocum-Dickson Medical Moment, courtesy of Slocum-Dickson Medical Group on Burstone Road. SDMG.com is the website. Of course, like them on Facebook as well. Just type in Slocum and you'll be able to find it right there. Plus, we'll put it up on our Facebook page as well. Worst case scenario, you find something, you get it checked out, it comes back positive. What is the treatment? How does it go? And the first step is to see your primary and then get referred. Is that the first step? And then what goes on from there?
Yeah. Well, certainly once you make the diagnosis, and there's a lot of different types of skin cancer. The most common type, the basal cell skin cancer, luckily is very treatable. It's not deadly. It doesn't spread and kill you, but it can be disfiguring if you ignore it. So early treatment is important, and depending on how early the process is, it can be a very superficial treatment. Sometimes there's minor surgical procedures. Most of the time it's a procedure that can be done in the office with Novocaine just to remove the area that's involved. And then you need to be closely followed. If you've had one over your lifetime, there's a very good chance you're going to get another. So you need to, again, avoid the sun and be followed closely.
Absolutely. Again, we're talking to Dr. Krasniak, plastic surgeon at Slocum-Dickson Medical Group, and Adrian in studio as well. All right, so now that we've talked about skin cancer, can we talk about the loose skin I have? Because I would really like to just...
Adrian, do you have my card?
It's got to be, I don't know, doing what you do. And, you get to see, the good, the extreme good and the extreme bad, the changing people's lives in a positive way but also helping people on this other end. With each patient, it's got to be, it's almost like a new journey with each patient.
I'm blessed to be doing what I'm doing because I do children from newborn to patients over 100 years old. I see things from the top of your head to the bottom of your foot. We see all sorts of things. It's very interesting for my part to be able to do a lot of different things. But luckily, what I do, I don't see a lot of really serious cases. Luckily, skin cancer, for the most part, is curable unless we treat melanoma, which a patient dies every hour in this country from melanoma. So that's something we take very seriously. But I'm sort of blessed that I do have sort of healthy patients and patients that, end up with a happy result. And so I'm happy about that.
Absolutely. Dr. Krasniak, plastic surgeon at Slocum-Dickson Medical Group on Burstone Road. And if you're looking for a new general practice physician, there are taking new patients at Slocum. You can go to SDMG or like the Facebook page as well. And Adrian, enjoy the Go Red for Women luncheon and the expo later today.
Yeah.
Guys, thank you so much for coming in.
Thank
Definitely
you.
appreciate it.
Thank you.
Thanks.